We are honored to have you here and to interact with us for the next 45 minutes. So the CII deeply appreciates the government's commitment to take on the challenge of an unprecedented health crisis in the form of COVID, which has engulfed the world and has also affected India. The continuing battle between lives and livelihood is something which you must be focused on every single day. We also laud and appreciate the government's broader and intense and frequent stakeholder consultations with industry in the last few months, particularly on the subject of COVID and lockdowns. Your leadership in steering, surveillance, manufacturing of PPEs and other critical care essential items were timely and with an extraordinary precision. Given the size and scale of our country and the population, the exemplar processes and precautionary measures put in place have saved us from much higher possible number of cases of infections and death. CII realizes the task of the next big challenge which is going to be in front of us, which is the task of administering a vaccine to 1.3 million people. And that too, this has to be done in record time. We at CII have constituted a high-level task force on COVID-19 vaccine led by Mr. T.B. Narendran, President-designate CII, Dr. Randeep Guleria, Chairman CII Public Health and Council Director, as also Director of All India Medical Sciences. The objective is to galvanize business and industry support in the government's efforts of distribution and inoculation of the COVID vaccine to the Indian population in the coming months. The CII COVID-19 task force would work closely with the government and support the government's efforts, and we do look forward to your guidance in this matter. We at CII stand by our continued commitment to the government in support during these times and would work on areas of priority which makes a national importance, both from the point of view of business, industry, society, and of course the thoughts of the government in that subject. I would like to assure you that this is a crucial moment where we have to work together as one team, one India. May I now request Dr. Harshvardhan to kindly address the Council, after which we will open up for some discussions on the subject. Mr. Minister.
Thank you, Mr. Uday Kotak ji, the President of Confederation of Indian Industry. I understand that Mr. Chandrajit Banerjee is also there, Director General CII, and all the esteemed members of the Governing Council, National Council of CII are there, and other esteemed distinguished guests who are present in this meeting. So let me first of all express my sincere gratitude to CII and all the members of the National Council for, number one, giving me the opportunity of being with you and talking to you, interacting with you, and then, of course, the way you have promised and offered your wholehearted support on behalf of the Confederation and the members for ensuring success in the delivery of vaccine to millions of Indians in the ensuing months in 2021. So just to give you a brief overview of where we stand about around this COVID issue, and just a brief recall of the sequence of events that have taken place during the last many months. You see, for us in the Health Ministry, we are into the 11th month of our fight against COVID. If you would recall that earlier also I had spoken to the members of the Confederation during the course of this pandemic. So just to remind you that we had taken the first call on this issue on 8th of January. That was just the literally the first week of this 2020, and that was in fact probably the first call taken by any country officially and also in a I would say institutionalized manner to respond to the breaking news that came on 6th of January when WHO was officially informed by China about the appearance of cases of pneumonia in China, which they attributed to a new coronavirus. And within less than 48 hours of that, we had organized our first meeting of experts in the health ministry on 8th of January. So that's why I said that on 8th of November, we had literally completed 10 months of our struggle against COVID, and we are into the 11th month now. And then the events that have followed after that, you will all recall that by 17th of January, we had issued detailed advisories to all the states. So every state health department was on board about how to actually handle and tackle and fight COVID, how to manage COVID outbreak in their own states, if at all it happens at any time. And then immediately on the same day, 17th of January, we had started our point of entry surveillance. We had geared up our community surveillance activities, and then you will recall that we got our first case on 30th of January. And then after we got our first case, immediately the Prime Minister had constituted a group of ministers headed by the Health Minister, and this group of ministers with other ministers and other senior bureaucrats in the government has met almost over 20 times in the last 10 months. And then of course you all will recall that around the same date WHO had in fact given a warning to the whole world that there is an emergency of international concern. And then in the month of March, a pandemic was declared on probably on 11th of March or something. It was given the definition that it's a pandemic involving many countries. And then you would recall that the country under Prime Minister Narendra Modi ji took a very bold decision of enforcing a lockdown. And before the lockdown, there was that innovative experiment, a brainchild of our Prime Minister, about that Janta curfew on 22nd of March, where there was a voluntary participation from every Indian, and then a felicitation to all the health workers of the country at 5 o'clock on 22nd March. And then during the course of the lockdown, there were 5 studies of national and international standards where they all inferred that the lockdown could save millions of cases from happening, or could save many lives which could have been lost. And then when there was a time to take a bold decision to start unlocking, when we had all those issues related to economic crisis, people were losing jobs, people were finding it difficult to make their both ends meet, and so many problems came during that period. There was the crisis due to Tablighi issue during the middle of March. There was a crisis around the migrant laborers. So many things have happened all these years. So the government took the bold decision of a lockdown also. The government took the bold decision of an unlock also. when it was necessary to strike a balance between uh, what I would say that saving people's lives from COVID, and also to ensure that we are taking care of the economic issues, the livelihood issues, and all the issues of people's day-to-day requirements in their public and personal life. So that balance could be struck because we started with an unlock activity in a graded manner, and right from the very beginning, the government has adopted a proactive and a preemptive strategy, and also you would recall that very proactively everybody rose to the occasion. It's you see, you all also rose to the occasion when there was a need, and everybody in the government, you see, all the it was not only the health department which was working to fight COVID. All our scientists rose to the occasion, and this is the same country where during the month of February or March, we used to hear, you see, noises around you see, shortages of PPE kits, shortages of labs and testing kits and N95 masks and ventilators and all those things. But the same country, within a couple of months, could ensure that by hand holding of people, and for startups, for the young budding entrepreneurs, or for the established people, the government did its best to make sure that the same country developed a capacity where we were producing a few lakh PPEs every day. We started producing ventilators in the country. We started, you see, exporting some of the drugs to over 150 countries. We started exporting N95 masks. And for a country where we started our journey with one lab, and the test that we talk about these days, a couple of years back, just to give you an idea, we used to send these swab samples to the laboratory in America. That's the Center for Disease Control. And these samples used to be airlifted. And when we started our journey in March, February, we started with a single lab. Today, when I talk to you on 20th of November, we already have 2,116 laboratories in the country. You travel around 3 kilometers anywhere in the country, and you can get a lab in 97% of India right now, where you can have a COVID test done. In the initial phases, we were forced to, in fact, you can say, import these testing kits from other countries, and now maybe we have validated more than 1,000 kits in our own country. The prices of all these things have gone down so significantly. There is a RT-PCR test, there is an antigen test, there is an antibody test. So many things have, and the scientists also simultaneously have worked around the clock. We were amongst the first few countries in the whole world where we could isolate the virus, and then after isolation, now we have already done genome sequencing of over 2,000 viruses in the country. We have a number of biorepositories where we have stored 40,000 samples of the virus for research by our scientists, for young scientists, for startup people, and for everybody, or for the industry, for whosoever wants to do research on the COVID virus. So the things have drastically changed, and we could overcome all these difficulties of various problems all across the country. We had problems in many big states, you know. They had been major, you see, problem areas for the country. And but right now, because of the joint efforts, because it's not only the government or the whole of government approach, it is also the whole of society approach. When millions of our poor people were struggling to actually make even basic requirements like food available for them. Hundreds and thousands of non-government organizations, well-meaning NGOs, they all stood up and they started helping, supporting. I remember having spoken to a few thousand NGOs on the with a video conference with the help of Niti Aayog during the course of this pandemic. When there was a need to handle the migrant laborers, the country could send them to their native places. Almost 65 lakh of these were sent to the native places by our, with the help of the railway ministry and by buses and all. So it is just a brief recall of so many things that have, and then the Prime Minister, right from the beginning, has been monitoring at the highest level. He has been doing all video conferences with the chief ministers continuously. I have been doing video conferences and telephonic calls and continuous communication with the health ministers of the country, the cabinet secretary, the health secretary. They have also been in touch, and we have been in touch with the so many organizations in the country to make sure that we are fighting the war against COVID as one single unit. And during the course of all this, you have seen that even during crisis, the Prime Minister could bring about so many packages. I don't want to get into the detail, but I remember that the Finance Minister took almost 7 days and 7 press conferences to describe those packages about around which the Prime Minister was trying to help the people, the industry, the MSMEs and others, and now is talking about a Atmanirbhar Bharat. He has been particularly, compassionate about helping the health ministry. We have helped all the states, not only financially but through all other possible ways, and the country in a small period of the initial few months could develop a capacity of dedicated COVID hospitals and COVID health facilities and COVID care centers and quarantine centers, where almost over 20 lakh beds have been created, oxygen supported beds, ICU beds, and then a lot of beds in the quarantine centers. There has been a well defined strategy to fight COVID, a strategy to test, track, and then treat as early as possible. So you are all familiar with all this that has been happening. And the result we have seen that all through this fight, India has been performing better than the rest of the countries of the whole world in terms of any parameter that we spoke at any time. Today we have a recovery rate of 94%, we have a fatality rate of 1.47%, and we are testing over 1 million people every day. We have already tested over 13 crore people till now. I have mentioned to you about the labs, our cases per million, our deaths per million. Any parameter, when we compare with the rest of the world, even with the most developed countries, in a country of 1.35 billion people, we have already, I think, achieved standards. And right now, if we don't discuss at the present moment the capital where we all live, where unfortunately the things are not as per our expectations, although we had forewarned about the impending cold weather, impending festivals, and impending pollution issues, etc., which could aggravate the situation. But rest of the country, broadly, even in places like big states like Tamil Nadu, Maharashtra, etc., Karnataka, Andhra Pradesh, where we were facing big, huge problems, there has been a very significant decline in cases. We used to have almost 10 lakh active cases in the country. Now we have close to 4 lakh, 4.5 lakh active cases. Similarly, every day we were getting something like, a few weeks back, we were getting something like 90,000 to 1 lakh cases per day. Now we are getting close to 50% of that, less than 50% of that. So broadly, things appear to be uh, under control. And then what was mentioned by Udayji in his opening remarks, that countries, and for which you have also offered your support, the scientists have, apart from the various other issues that they have worked on, I mentioned about a couple of them, but they have been trying to discover drugs, they have been trying to repurpose drugs, and so many things are happening on the scientific front. It's not the moment to describe them in detail, because I also had the Science and Technology Ministry. I can keep on talking about the things that are happening inside our laboratories, but the very crucial and the most contentious issue that the country is discussing and thinking about and dreaming about is, when will the vaccine arrive? So I can very broadly tell you that we are not inferior to anybody else in the world as far as the research around the development of the vaccine is concerned. You already know that India is a supplier of vaccine for 60% of the children of the whole world, otherwise also. And in over 200 vaccine candidates all over the world, 30 candidates belong to India, where they are doing research and are in various phases. And at least 5 of them are in clinical trials, 2 of them are in almost significantly ahead in the phase 3 clinical trials. And if I have to give you in one sentence, I think briefly we expect that in the next year, maybe in the first few months of the next year, we should be getting vaccine in our hand. And we propose and hope, and with the reports that we are getting, we intend to uh, immunize around 25 crore to 30 crore people by the month of July, August. That's our intention and that's our plan. And that's what I think we expect, with availability of 4 to 500 million doses by the various people that we are negotiating and trying to have a feel about the whole situation. So I am so happy, and there is so much happening inside our ministry for not now, but even for the last 2 3 months, around the planning for delivering these vaccines to the people of India. As you all know that we can't have a vaccine for 135 crore people at the same time. So an expert group has prioritized who needs to be given first, and then according to that priority, lists are being drawn. The states are already on board. Many of the lists have already been done, and after this line listing, the details are being uploaded, electronic platforms are being worked out. And the good thing is that India already has a very robust vaccine delivery system. We give in the universal immunization program, we give vaccine to we give almost a dozen vaccines to all our children all across the country, free of cost. Recently, we did a very huge measles rubella vaccination program, probably the biggest in the whole world. We have already eradicated polio from our country, where for the past 25 years we have been giving oral polio vaccine to our children less than 5 years, maintaining a cold chain of at minus 20 degrees centigrade. So we have enough of experience, but for the new venture that we are proposing to have in 2021, we have identified the possible and the potential gaps, and we are in fact ensuring that we are taking care of all those gaps right now, so that we could deliver the vaccine very smoothly. And of course, an offer of support from organizations like yours, 125-year-old Confederation of Indian Industry, I think that means a lot to us. So many big organizations have already approached us. We have had meetings with them, that how can they actually help voluntarily to ensure the delivery of these vaccines because of course the vaccinators etc., they will all be official people, and they all have to be trained. Training programs are also simultaneously taking place about it. So I would like to hear from you what is and how you would actually propose to help us, and then once you are keen to help us, we would certainly like our expert groups also will have discussions and deliberations with you, and we would like to institutionalize the mechanism through which you would like to help the government, and every offer of help of any nature in any form at any time at any place by any number of people belonging to CII would be very heartily welcomed by the government. And I fondly remember that India could achieve polio eradication because I know that in '94 there was so much of support from organizations like yours and Rotary International and PhD Chamber of Commerce. So many means I don't want to get into the details of that. I had the support of over 400 organizations in the city of Delhi itself in 1994. So I have a good amount of pleasant experience and feelings about the support that society has the potential to make a government program run smoothly and successfully. So that's all about it because we have limitations of time, but I thought let me give you a brief overview of a sort of recalling and just rewinding the whole 10 months journey that we have all been together. No doubt we unfortunately lost a few thousand people in this. We lost a few hundred COVID warriors, our esteemed health professionals who have been working relentlessly, tirelessly during these 10 months with utmost commitment, spirit, dedication. And I always say hats off to the mothers of these COVID warriors because there is not a single mother in the country who has stopped or who has asked his children not to be COVID warrior anymore, because everyone is seeing how the COVID warriors are also losing their life. But to protect our lives, our doctors and nurses and other paramedics, they have been leading from the front and even risking their own lives. So occasions like this are moments when we pay our tributes to these COVID warriors also. So that's all I think I would love to say at this moment. Maybe at a future meeting we could have further detailed talks and discussions. I was told that some of you wanted to interact, some of you wanted to express some opinions or suggestions, or maybe you have some queries about what the government's intentions are. So I hand over the floor back to Mr. Uday or Mr. Chandrajit, whosoever is conducting the proceedings.
Thank you very much, Dr. Harshvardhan. Chandrajit is very much here and on this, and we really appreciate your commitment to take this single biggest challenge facing the world and India, and we are actually quite comforted by your being there at this chair at this very crucial ministry. I would now like to request CII President Designate Mr. Narendran, who also is chairing the task force on vaccines, to first start with his points and interaction for this discussion today. Narendran, please.
Okay, yeah, thanks Uday, thanks Mr. Minister. Just a quick update because we've had some interactions with the government. So I'm co-chairing the CII Vaccine Task Force along with Dr. Randeep Guleria. And we've said we'll help work with the government on 3 areas because Dr. Valerian, the team, we discussed what could be the areas where we could provide support as CII. So one is in strengthening the vaccine distribution and delivery chain. 2 is in catalyzing and leveraging the support of the various healthcare sector stakeholders that we have as members of CII, as well as the other members, and exploring the leveraging of technology to reach the last mile. Following this, we had an interaction with the National Expert Group on Vaccine Administration under the chairmanship of V.K. Paul and co-chairmanship of Mr. Rajesh Bhushan on 11th of November. So the CII team had this interaction with them. And I think the request from the government was for us to work on 4 areas. One is to look at how can we mobilize human resources to undertake the administration of vaccine as well as the capacity of especially healthcare sector to train such personnel amongst our membership. So this is to be done at a state level, at a block level, at a district level. The second area where we were requested to chip in was on looking at the capacity in private sector for cold storage of vaccines and vaccine transport and other abilities of the cold chains that may already be existing and how can that be leveraged. The third area is to look at the capacity for CSR of the members and how they can support in specific areas. And the fourth area is to identify joint locations where such inoculation administration can take place statewide. So these are the 4 areas which we took back from the meeting as areas for CII to work on. So we are now creating a cross-functional task force, including the relevant members of CII, and we were waiting for the session today to hear you as well. And then over the next few days, we will work with our members and engage more deeply with Dr. Paul and Mr. Rajesh Bhushan. So this is the update over the last 10 days or so, the work that we've done in this task force. So again, as Sudhir said, we are happy to provide all help and assistance. Our members are very keen to play whatever role they can. We also discussed that having a deeper understanding of the listing of people and how do you administer to them, etc., will help us, and the private sector can work very closely with the government bodies in this very, very challenging exercise.
Minister, there are some other people who want to ask a question. Therefore, can I combine a few questions before you respond?
Okay, perfect.
Okay. Second is Shobna Kameni. Shobna, may I request you?
Namaskar, Dr. Harshvardhan. I must say that over the last 11 months, I am proud to be a healthcare worker in India, and especially after hearing the way that you spoke about it so comprehensively, and you really were inclusive about what all of India's capabilities. And I must say, not only have we actually battled the pandemic well, we've actually established world standards in terms of mortality rates and about the new protocols. And of course, we will be the vaccine leaders of the country. So I'd like to come straight down to that question and ask you, one is that we pledge support with CII and for the country and Apollo Hospitals, as you know, that we've made a statement that not only could we store at any given time 12 million vaccines, but have the capability to distribute 300 million over a year and actually administer 1 million vaccines. So this is a reach out through CII, through the private sector, that this is an exercise, just like throughout the pandemic, the private and public must come together at this point of time, and it's just a question of service. So please make sure that your plans have a very deep usage of the capabilities, of the great capabilities this country, private healthcare in this country has. The second question is that, Dr. Harshvardhan, I do appreciate that India will give this vaccine at a great price point and possibly to many people free. But we would like to reach out and say, the question I'd like to ask is, can private sector actually procure? Will you allow us to procure and administer, or would you just give us supplies for us to administer? So this is the question that we've all been waiting for. Thank you.
Minister, I'll have one more question and then you could answer. The third person I'm going to ask is Mr. Thiagarajan of Blue Star to give the cold storage perspective as well. Mr. Thiagarajan.
Thank you, President. Minister, thank you for your address. I endorse the view that we have a robust vaccination program going on and the administration is good. It can be compared with the best in the world. But I still believe that in order to expedite the administration, private sector involvement may be necessary, number one. Number two is the state governments are not yet, while they are augmenting the cold storage, they have not yet fully completed the process. They are not aware of how this is going to be rolled out. So there seem to be some communication gap. The last point I want to make is that the own manufactured equipment are not allowed under CSR to be donated. At least for vaccination program, you should permit it because the industry may be interested in donating such equipment under CSR. Thank you.
Minister, over to you, sir.
Okay. Thank you, Udayji. I think as Narendra ji, our incoming president and also the chairman for your expert group, he has mentioned the ways through which you could help. And I think you are already having discussions with the national expert group. And I am happy that these discussions are already on their way. And I can only tell you that your involvement is going to be very, very crucial. You see, today we have a lot of experience, but when I recall in 1994, when I was blessed to dream about a polio-free India, there was not even a single rupee in the Delhi's health budget for such a program. And when we started the program, I had to reappropriate 20 to 25 lakh rupees from 4 major hospitals of Delhi to create a fund of 1 crore rupees to work for that. But to my rescue came people from the industry, from the NGO sector and Rotary and others. And majority of the things around publicity and creating so many things, they were all, we did not take even a single rupee, but in kinds, there was so much of support from everybody that even with that meager 1 crore rupees, we could actually accomplish the task of doing a successful pulse polio program in Delhi, which was later replicated in the country in 95 and in Southeast Asia in 96. But this was all, so I am very, very confident that with your support in terms of supporting through manpower, through volunteers and through, of course, CSR and at number of places through whatever. You see, right from the beginning in this COVID war also, we have always, allowed this fight to grow along with the participation of the private sector at every stage. So we have never even in our remotest thoughts thought that it's going to be a government initiative. It's going to be it's a whole of society approach, whole of nations approach, and you are very much part of us, and you are all going to be there. In now the issue is only about working out the modalities, how and in what forms the ministry will work with the industry and others, and where what industry will help in what form to whatever extent they can. I'm sure once the process is on for discussion between CII, his top person and his group, and our national expert group, which is deliberating on all the relevant issues around the organization, and we are going into the very I would say minutest details. There is there is an electronic platform which was earlier likely to track only the vaccine and the temperature right from the manufacturing site to its delivery, but now this vaccine, this e-win platform has been converted into a co-win platform, where every person who will be vaccinated, he will also be tracked on that platform, that who was vaccinated, where, by whom, at what time and what place, and he will be given an electronic message that he has to be there at that time, and then of course he'll get an electronic certificate, and then there is a monitoring program for giving him the second dose. So all those things are being worked out. Training programs have started for, because somebody mentioned that there is a communication training programs have started for the possible vaccinators and all these state government officials at all levels. So I am sure that to address the issue that has been addressed by Naren ji, I think you are already into those deliberations, and I can